you tell someone who's thinking of getting into the digital health entrepreneur game today? So I actually toyed around with this when I left St. Joe's, and I was going to go to the digital space, and I talked to a bunch of people, and it ranged from don't do it to you know to race for it. It's going to be awesome. So what would you tell somebody?
Um, uh, Somewhere between those, I would say that you can make a huge difference, but it's going to take a while. You know, one of the things when we worked at Microsoft, oftentimes, you know, you'd have crazy deadlines and you'd have to ship things, and at a certain point, you know, people would say, "Look, we're not saving anyone's life here. We can't say that anymore." And we love that. You know, it's like we can save someone's life. We can prevent a complication or a readmission by catching it early. So I think that with digital health, like, you can have such a big impact, but you're gonna have to be patient, and you also have to be empathetic both to your users, whether those are patients, but also the clinicians. You know, there's a lot of I think Dave Chase said once that he's a Seattle entrepreneur who's beating a drum of changing in healthcare, but he said he wants people who want to disrupt from a place of love, which is, you know, you have to, like, the clinicians are not going away. They're stuck in a system. Don't be disdainful of them. Understand the pain that they're feeling. Like, every time I see these articles about physician burnout from EMRs, I was like, in what other industry is the problem of, like, your technology is making you hate your job? Like, hate your job. I don't, that should not be the case. So that's what I say is, like, go for it, but, you know, you gotta be patient. It's gonna take a while.
Disrupt from a place of love. I love that terminology. If you could pull one policy lever.
Wait, I wanted to, sorry.
Go back.
I have one more thing that I was saving, which is, if you're looking for a new opportunity, I would go back to, again, all these new organizations that are forming.
Yeah.
Because there's something there. They're going to need something. And I think that, you know, one of the challenges of value-based care is that the EMRs are not designed to link outcomes to costs. So I don't know if that's the thing to do, but, like, all these new organizations are going to need some sort of new technology, and I don't know what it is.
Yeah, and if people didn't know you were from Canada, when you say organization, they'll know you're from Canada. So.
Oh, why? Is there an accent there?
No, organization. It's organization, but
organization. Oh, interesting.
Yeah. You know,
I got rid of a lot of my Canadian accent, but there's still a few things that come
up. Process and process are the other one.
I say process now.